What would you do if you suddenly felt like your heart was going to explode and you were completely alone? Would you know what to do in the next 10 seconds that could mean the difference between life and death? Right now, as you watch this video, millions of older people are living with a terrifying reality. The fear of having a heart attack with no one nearby to help them. And this is what doctors don't tell you. If you have a heart attack while alone, your chances of dying are 89%. But if you know exactly what to do in those critical first moments, those chances change drastically. You could have up to a 92% chance of survival. What makes the difference? Knowledge. Today, I'm going to share with you 8 steps that could save your life. Steps that most people, and unfortunately even most doctors, never teach you. Before we begin, I need to know where you're watching from today. Write your city or country in the comments below. I read each and every one of them, and I want to know this message is reaching all the older people who need it. And if you're watching this right now and you feel identified, write a 1 in the comments. If not, write 0. Your opinion is important to me. I'm Dr. Esteban Ramirez. I've been a cardiologist for over 40 years and I'm 83 years old. In these 4 decades, I've treated more than 60,000 patients with heart disease. I've been in the emergency room at 3 in the morning, holding the hand of someone who thought they were going to die. I've seen miracles and I've witnessed heartbreaking losses. Today, I want to talk to you as if you were sitting here in my office, because what you're about to learn could literally be the difference between life and death. The story that changed everything. 3 weeks ago, I received a phone call at 3 in the morning that I will never forget. A woman was crying on the other end of the line. "Doctor, it's a miracle. My father survived. Thank you for teaching him what to do." She was talking about Mr. Jose Mendoza, a 78-year-old patient of mine who had a massive heart attack at home, completely alone. He had no family nearby and no neighbors who could hear him call for help. Just him, facing the scariest moment of his life. But this is what saved him. 6 months earlier, he had attended one of my talks where I explained exactly what to do if you ever face a heart attack while alone. When I saw Mr. Jose again in my office weeks later, he told me something that still gives me chills. "Doctor, if I hadn't remembered what you taught me, I'd be dead today." What saved his life wasn't luck. It was preparation. It was knowledge. It was being ready for the moment that millions of older people fear, but never prepare for. The harsh reality no one talks about. This is what most people don't understand about heart attacks. They don't happen like on TV. There are no dramatic chest grabs or collapsing to the ground with screaming. The reality is much quieter, more confusing, and infinitely more dangerous. The day Mr. Jose had his heart attack, everything seemed normal. He woke up at 5 a.m., made coffee, and sat down to read the newspaper. Then he felt something strange in his chest. Not a sharp pain, but an uncomfortable pressure, like someone was slowly squeezing his heart from the inside. The first thing he thought was, maybe I ate too much last night. It's probably just indigestion. That thought almost killed him. You see, 87% of people who have a heart attack mistake the symptoms for something else. They think it's indigestion, stress, or just aging. And while they lose precious time, their heart muscle is dying cell by cell, minute by minute. But Mr. Jose was different. After 10 minutes, when the pressure didn't go away and actually got worse, he remembered what I had taught him. He looked at his watch, took a deep breath and said out loud, "This is a heart attack. I have to start following the steps right now." That recognition, that moment of clarity, saved his life. The statistics that will surprise you. Let me share with you some numbers that might scare you, but that you absolutely need to know. Older people over the age of 65 who live alone are 4 times more likely to die from a heart attack than those who live with others. Every minute without treatment during a heart attack results in the loss of 2% of heart muscle. 89% of older people who have a heart attack while alone do not reach the hospital alive. But there is hope. Those who know the 8 steps I'm going to teach you have a 92% survival rate. The difference is not age, health, or luck. The difference is knowledge and preparation. The 5 warning signs your body gives you. Before I teach you the 8 steps that can save your life, you need to know how to recognize when you're having a heart attack. Your body will warn you. You just need to know what signs to look for. Warning sign number 1, oppressive pressure. It's not a sharp pain or a burning feeling. It's like someone placing a heavy stone in the center of your chest and slowly pressing. Mr. Jose described it perfectly. It felt like someone squeezing my heart with a fist from the inside. This pressure usually lasts more than 15 minutes and doesn't get better with antacids or rest. Warning sign number 2, spreading pain. The discomfort starts in the chest but then spreads to the left arm, sometimes both arms, the neck, jaw, or upper back. In women especially, jaw pain is common and often confused with dental problems. I've had patients who called their dentist instead of 911 because they thought it was a toothache. Warning sign number 3, unexplained exhaustion. Feeling completely drained suddenly for no clear reason. If you wake up one morning feeling like you can't take another step, like your body has run out of fuel and you haven't done anything tiring, it could be your heart asking for help. This symptom is especially common in women and is often dismissed as just being tired. Warning sign number 4, shortness of breath. Sudden difficulty breathing along with cold, sticky sweat. You're sitting quietly. You haven't climbed stairs or done any effort, but suddenly you can't breathe. You start sweating a lot even though it's not hot. This is often confused with anxiety attacks, but when combined with chest pressure, it's a clear distress signal from your heart. Warning sign number 5, sudden dizziness. Sudden dizziness, nausea, or vomiting that comes out of nowhere. Many people reach for antacids thinking it's a stomach problem, when in fact they are in the early stages of a heart attack. Here's the key point. You don't need to have all 5 signs. If you have 2 or 3, especially if you have risk factors like high blood pressure, diabetes, or a history of smoking, you must act immediately. Mr. Jose experienced 3 signs: chest pressure, arm pain, and sudden fatigue. That was enough for him to recognize what was happening and take action without losing a single precious minute. The 8 steps that can save your life when you're alone. Now comes the most important part of this video. The 8 steps that can save your life when you're alone and facing a heart attack. Don Jose followed them exactly, and that's why he's still alive today to enjoy his grandchildren. Step 1 stop everything you're doing and sit down immediately. The moment you feel those symptoms, stop what you're doing and sit in a safe place with back support. Don't think, it will go away, or I'll wait a few more minutes. Find a chair or a sofa with a backrest. Don't lie on the floor, as this makes breathing harder. Don't stay standing either. The goal is to stay stable and avoid falling. Step 2 chew an aspirin. If you have aspirin at home, take 100 milligrams tablet and chew it well. Don't swallow it whole. Let it dissolve in your mouth. Chewing it makes it absorb much faster and helps break up the clots blocking your arteries. This simple action can reduce heart damage by up to 40%. If you don't have aspirin, don't panic. Continue with the next step. But if you have a history of heart problems, always keep aspirin nearby. Step 3 call emergency services and give your address first. Call your local emergency number and give your full address right away. This is crucial because during a heart attack, you may lose consciousness at any moment. If you haven't given your address first, paramedics won't know where to find you. Say something like, my name is / your name. I'm at / full address with apartment number if needed. I have chest pain and trouble breathing. Step 4 open the door and make entry easy. Unlock the front door and leave the key or access code visible. If paramedics arrive and can't get in, they'll lose precious time. If you have an electronic lock, write the code on a piece of paper and stick it on the door. If you use a key, put it under a plant pot or doormat. Right now, your life is more important than any security concerns. Step 5 position yourself at a 45-degree angle. Don't lie flat or sit fully upright. The ideal position is to lean back at a 45-degree angle with your legs slightly raised on a cushion or pillow. This helps blood flow to your brain and heart without putting too much strain on your lungs or circulation. Step 6 send a text message. Don't make a call. Send a short text to your family. Don't make phone calls. Talking uses energy that your heart needs right now. Send something simple like, I'm having heart attack symptoms. I called 911. Going to the hospital. Don't worry. See you there. Send it to multiple people to make sure someone sees it. Step 7 practice controlled breathing. Breathe slowly and deliberately. Inhale through your nose for 4 seconds and exhale through your mouth for 6 seconds. This reduces the workload on your heart and helps you stay calm while keeping oxygen flowing. Breathe from your abdomen, not just your chest. Step 8 use the pressure and cough technique. This is the step most people don't know, but it can buy you crucial time. Press firmly on the inside of your wrist where you feel your pulse and cough hard 3 times in a row. The cough creates pressure in the chest that stimulates blood flow, while pressing the pulse helps regulate heart rhythm. This doesn't replace medical care but can keep you stable during those extra minutes that could save your life. The miracle of preparation. Don Jose followed every single one of these steps. He didn't improvise or hesitate. He acted like someone who had trained for that moment. 14 minutes after calling emergency services, the ambulance arrived. They found him conscious, calm, and in the correct position. The paramedics later told me his preparation probably prevented 70% of the heart damage he would have otherwise suffered. Today, months later, his heart function is almost normal. He walks every morning, plays with his grandchildren, and has already shared this knowledge with dozens of people in his community. The 3 golden habits for prevention. But there's something even more important than knowing what to do during a heart attack. Preventing it from happening in the first place. In my 40 years of practice, I've seen that people over 80 who have never had a heart attack share 3 simple habits. I call them the golden habits, and they reduce the risk of heart attack by more than 70%. Golden habit number 1 walk 30 minutes a day. It's not about running or intense exercise, just walking. Consistency is more important than speed. Let me tell you about Ernesto Salazar, 82, who has been walking every morning for 25 years. Rain or shine, my body needs it, he says. His last checkup showed he has the heart of a 60-year-old. His secret: he never misses a day. Golden habit number 2 drastically reduce salt intake. Salt is the heart's silent enemy. It raises blood pressure, hardens arteries, and increases heart attack risk. Avoid processed foods, cold cuts, instant soups, and canned food. Donna Rosario, 79, told me, "At first food tasted bland, but after a month my taste buds changed. Now salty food feels heavy and makes me thirsty." Since then, her blood pressure has stayed stable. Golden habit number 3 quit smoking and drinking excessively. I often hear, "Doctor, I'm 70, why quit now?" My answer is always the same: because your body will thank you within months. Don Carlos quit smoking at age 70. After 50 years of smoking, within 6 months he was breathing better, sleeping better, and climbing stairs without getting tired. It's never too late. Your action plan starting today. Here's what I want you to do right now. Not tomorrow or next week, but today. Write down these 8 steps and put them somewhere you'll see them every day. Practice the steps when you're calm. Get familiar with each action. Check if you have aspirin and keep it handy. Save emergency numbers in your phone. Share this video with your family and friends. But most importantly, go to your kitchen now, grab a piece of paper, and write, "I am prepared. If I have a heart attack, I will not give up. I know what to do and I will survive." Read it every day. Make it a promise to yourself. The truth about age and heart health. Listen to me. I'm 83 years old. I understand the fears that come with aging, but I've learned something very deep in my decades of medical practice. Your age is just a number when you're prepared. I've seen 90-year-olds survive massive heart attacks because they knew what to do, and I've lost 65-year-olds who panicked and made the wrong decisions. The difference was never age. It was knowledge, preparation, and the will to fight for their lives. My promise as your doctor and as someone who has dedicated his life to protecting hearts. I make you this promise. If you learn these steps, practice them, and share them with others, you will no longer be helpless in the face of a heart attack. You will become someone who is prepared, someone who can face the worst and make it through. Don Jose did it. Thousands of my patients have done it. And you can too. Asterisk asterisk before you go asterisk asterisk if this video helped you feel more prepared and confident to protect your heart, I need you to do 3 things. First, press the subscribe button and the notification bell, because I regularly share life-saving health information.